Good morning, ladies and gentlemen. Good morning, ladies and gentlemen. My name is Ting Fang Yi, and I am the Marketing Director at Napier Healthcare, and I'm charged with taking the message of empowerment through digital transformation for today's healthcare. Also, yes, I am your host for this webinar. On behalf of the team of Napier Rice talking to you today, I must say a very, very big thank you. Thank you for taking the time off your busy schedules today to join us as we talk about the challenges facing hospitals today and delve into how a digital transformation may well enable operators to overcome them. As you can see from the agenda, we have a lot to cover today. We shall make our presentation short and sweet and leave as much time as possible toward the end for questions from you. So give us difficult questions. Finding out more about what concerns healthcare leaders are at the heart of what we do. We are constantly looking to establish, maintain, and enhance engagements with you as a partner in the provision of increasingly better care to the people we serve, for now and into the future. Before we begin though, here's an introduction to Napier Healthcare, who we are. Napier Healthcare Solutions is a specialist information and communication technology provider to the healthcare industry. We're based in Singapore. We're a global in impact across Asia, Australia, New Zealand, Africa, the US, the Middle East, and Europe. Our solutions portfolio covers both acute care and intermediate and long-term care. So we power hospitals and clinics, hospital and clinic networks, and other specialized medical facilities. We also power nursing homes, retirement villages, and other specialized and other elderly care facilities, as well as community healthcare providers delivering home care services. Our body of work in the past 20 years has clearly made an impression on the healthcare industry, and we continue to receive industry recognition, most recently inclusion in the KLAS Global EMR Market Share and Population Health Reports, and multiple wins in award programs by Aging Asia and Frost & Sullivan. Now for our speakers today. First up, our Chief Medical Informatics Guru, Dr. K. Vijay Lakshmi, we call her Dr. Vijay, who's our AVP for Clinical Informatics at Napier Healthcare Solutions. She is a physician specializing in dermatology. She has been practicing medicine for more than 2 decades, notably with the Royal Oman Police Hospital, Jabir Al Ahmed Armed Forces Hospital in Kuwait, and Al Nada Hospital in Oman. As the CMIO of Napier Healthcare today, she brings a wealth of expertise and experience as a seasoned medical practitioner to bear on healthcare providers' technology adoption challenges so they can better derive top dollar returns on their IT investments. To your right, our acute care expert is Mr. Sudhakar Akala. He's with the product group at Napier Healthcare Solutions. He also has more than 20 years of work in healthcare IT. Sudhakar has held multiple leadership roles in the design and development of systems for healthcare providers, in particular for public and private hospitals across Asia, the Middle East, as well as India. A number of the projects he has done throughout his career have been major government initiatives that have enhanced the operations and standards of care delivery of hospitals and clinics in the Middle East and India. Next is our product specialist, who will be showing us the versatility and eminent usefulness of Napier Hospital Information System, HIS. And her name is Dr. Vipasha Kapil. She's a solutions analyst, a product specialist as well, at Napier Healthcare Solutions. Dr. Vipasha's specialty is in bridging client needs with solutions development, making sure products are developed to fit the operational and strategic processes and reporting needs of customers. She plays a key role of liaison between Napier Healthcare product development and its customers in the real world of implementations. So, with the introductions done, I shall now pass this session on to Dr. Vijay Lakshmi. Doctor, please take this virtual stage.
Thank you, Fangi. Good afternoon, everybody. Thank you all for joining us for this webinar. Over the past decade, virtually every major industry has invested heavily in technology, and technology has become an integral part of our daily lives. We cannot imagine living in a world anymore without our smartphones, laptops, the internet, apps for banking, shopping, and now even for hailing cabs. However, there is a general perception that is often justified that the medical field is reluctant to modernize and slow to embrace and adopt to advances in technology to offer better care to patients. In many hospitals around the world, physicians would still prefer working as they have for centuries with thick paper files, and the resistance to the adoption of EMRs is high. The aim of this presentation is therefore to explore the reasons for this reluctance to the adoption of EMR systems by the medical fraternity, why this reluctance must be overcome, and the immense advantages that EMR systems have over the traditional paper-based systems. Next slide, please. So this slide shows us the major challenges in EMR adoption initiatives. The first one is workflow disruption. One of the major encounters in any hospital, there is already a workflow in place which is running smoothly, and switching to a new system will result in disruption to that smooth workflow. For example, the way doctors and clinical staff's time on different clinical tasks may change, workspaces will be used differently. There will also be a complete change in how appointments are scheduled, patients are admitted, medication is ordered, and also how labs are ordered and results viewed. For example, as a dermatologist, if I had a patient with a very simple condition like tinea corporis, a small patch somewhere, it would take me a maximum of 8 to 10 minutes to ask for the history, perform a physical examination, and give him a written prescription, and then the patient would be out on his way to the pharmacy. However, when I adopt to an electronic system, I would have a lot of data to input that is mandated by the system and also by the regulations for that country. And so it will take me more time. It will take me time to order the prescriptions through the electronic format. And so unless a practice anticipates this change and prepares accordingly, there can be potential disruptions that might increase the resistance to using these systems. Another crucial factor that acts as a barrier to the adoption of these technologies is time. A lot of time is required for researching the market and selecting and deploying the correct EHR for that particular practice. It then takes time to train medical and non-medical staff and for everyone to learn the system. We know that EHRs rarely function perfectly on the first try. It takes time to identify inefficiencies and work from there to improve them. All this time lost may also have a severe impact on my practice. For example, if I was seeing 40 to 45 patients per day before, I might now have to scale down these numbers to 20 or 25 during the implementation phase, and this will definitely affect my practice and revenue. Implementing an EMR also means switching from a paper-based to an electronic-based format. This involves transferring records between the two systems. So say I have a 10-year-old practice, I would have accumulated a large database of paper records that I would need to import into the electronic format, and this has to be done accurately and completely. This task might sometimes appear so arduous and daunting to doctors, and they might just decide not to make the switch. The third factor is cost. One of the most important deterrents to the adoption of EHR is the enormous upfront costs involved in buying and deploying these systems. This is especially true for small and medium-sized practices who may have limited IT budgets. And it's not just the initial costs. There are ongoing costs of annual maintenance, the cost of upgradation, etc., that might discourage doctors and make them reluctant to invest so heavily in these systems, especially when there is uncertainty about the return on investment. The next point is poor computer skills or computer literacy. This may not be very relevant today, as doctors are as technologically savvy as anyone else. And unless the EHR system is very complicated with poor usability, this challenge might not be very relevant anymore. Next concern is about the security and privacy. As doctors, we have traditionally stored our patient records in the medical rooms, in the medical records room somewhere in the basement of our hospitals, where they could be accessed only by authorized hospital personnel. The information contained in patient records includes everything a hacker needs for identity theft, personal information, and in case of billing records, banking and financial information as well. So when patient data is stored on clouds or servers, there is a justified fear among doctors that these records may be hacked or stolen, leading to complications in the future. The next point is the quality of vendors. Quality of vendors is a very important factor. If the vendor is unreliable, if the training is of poor quality, if the technical and after-sales support is poor, and if there is a risk that the vendor or the technology may become obsolete, the anxiety and resistance to the use of these systems again will be very high. And we come to the most important point, that is doctors' resistance. We often hear of how doctors are unwilling to use these systems and how they often drag their feet when it comes to adopting to technology. As cliched as it may sound, most physicians are in the practice of medicine because they want to help people, save lives, and improve the quality of life for those suffering from disease. So why then are doctors so reluctant to bite the technology bullet? I think this picture speaks 100 words. When there is an onslaught of technology, doctors feel that the special bond they share with their patient and from which they derive professional satisfaction is completely lost. Instead of it being the doctor-patient relationship, it is now the doctor-EHR-patient relationship. And for all the technology, patients also often leave the room feeling lost and feel they have not been heard and their concerns not addressed because the doctor is multitasking and paying more attention to the computer than to them. Apart from this, there are also several other reasons why doctors may be reluctant to bite the technology bullet. The first thing is poor EHR usability. From practical experience, I can tell you that poor EHR usability is a cause of tremendous struggle that doctors have with EHRs. In many systems, there is a clear mismatch between how physicians work and the way these EMRs are programmed. As a doctor, I want to do what I was trained to do, and that is to take care of my patients. Instead of that, if I have to grapple with complex graphic user interfaces, templates that make data entry tedious, systems that do not allow users to skip steps and are very rigid, and have annoying and irrelevant pop-ups, this can be very frustrating and slow down my ability to provide good care. For example, if I had a patient with a minor dermatological problem, such as a acne vulgaris grade 1, or maybe a mild case of seborrheic dermatitis, but the system forces me to enter the findings of systemic examination of the CVS, RS, etc. before I can get to the medication module, that would definitely be difficult and frustrating. The next is that we often hear from doctors that they have just become data entry operators with these systems. Many times, EMRs do not end up saving time. Instead, the doctor spends more time on clinical documentation than on patient interaction, especially if the doctor is slow at typing. One study found that most doctors spend about 50% of their working day in clinical documentation, administrative, and clerical data entry work. So if I were to spend, say, 4 hours of my working day in documentation, then that is not effective use of my time, nor does it augur well for patient care. The next factor is failure of system. Fear of system failures is another valid concern. I remember one occasion in our hospital when the system was suddenly down. We were in the middle of a very busy OPD. I had patients waiting for procedures. A number of appointment and walk-in patients were waiting when the system suddenly went down. There was no way we could continue because we had no backup paper files and no way to order prescriptions or labs. Patients had to wait for hours for the system to be restored. Some had to have their appointments rescheduled. This led to a lot of confusion and bad feelings. The final thing is, we often hear doctors say and bemoan the laws of art of medicine. As clinicians, we know instinctively that the human side of medicine, the attentive listening, the visual cues we pick up when the patient is talking, the continued eye contact with the patient, the careful history and physical exam are the pillars on which we base our art of traditional medicine. These are also the factors that satisfy the psychological need for human reassurance that our patients want. But having said that, we should remember that providing personalized care in this day and age will require much more than just the art of medicine. Telling a young lady that she has a stage 3 or 4 breast cancer requires time, compassion, and well-honed interpersonal skills. This is the traditional art of medicine. But beyond that, figuring out the exact chemotherapeutic regimen for her based on her individual genetics, comorbidities, and choosing from the hundreds of alternative therapeutic options available in the market today requires the help of science and technology. Today, medicine is advancing at a dizzying pace, and if we want to stay on top of the advances, we have to make use of technologies available to us in the form of clinical decision support systems, etc., and that can help us offer the best care to our patients. In the early part of my career in dermatology, I worked at a large hospital that had a complete paper-based medical record system. As in any hospital around the world, the majority of dermatology outpatients have chronic diseases like eczema, psoriasis, contact dermatitis, immunobullous disorders, etc., essentially conditions that have no cure. So most of these patients would typically have a follow-up duration of years and sometimes even a lifetime. Patients would be brought in with thick files that are splitting at their seams with pieces of paper that include lab reports, duplicate prescription copies, follow-up notes, admission notes, etc. Most of these papers would also be filed haphazardly, which made the task of finding anything very difficult. And many times it so happened that the files or some parts of it went missing, adding to the utter confusion and chaos. So in this setup, if I had, say, for example, a 40-year-old patient come to me for the first time with a 20-year history of psoriasis, it would be very difficult for me to browse his entire file and understand how his disease has fared over the years, what therapies he has had before and for how long, and review all past complications and comorbidities. At best, I might look back a few pages, but practically, despite my best intentions, I could never have the complete information about the patient that I would need to offer the best standard of care. Again, most patients on chronic immunosuppressive medications like methotrexate and cyclosporin and corticosteroids that we use in dermatology or any other branch need close monitoring of their blood parameters weekly, 2-weekly, or monthly, depending on the drug. In a paper-based system, in addition to the inconvenience of having to deal with numerous slips of paper from hematology, biochemistry, and other departments, there is a high probability that these results might get lost or misplaced, again leading to unnecessary repeat investigations, poor quality of care, and increasing the risk of litigation if there is any adverse reaction. Subsequently, I moved to a hospital that had a robust EMR system in place, and they were near paperless in their functioning. It took me about a couple of weeks to get used to the system, and I then realized that EMRs are so superior to the paper-based system that there is really no comparison between the two. This slide shows us the most important advantages that electronic medical records have over paper records. Fast and easy retrieval of complete medical records. This obviously is the most attractive feature of an EMR. With just a few clicks of a mouse, entire patient history of many years duration can be retrieved. For example, in the patient that I was discussing before, if he has a 20-year history of psoriasis, I could just quickly click over all his past encounters and see exactly how his disease has fared over the years, how many times he has had exacerbation, how long the disease was in remission, and I can go to the medication module and find out exactly what drugs he has been prescribed, for how long, at what doses, and whether he reached the cumulative toxic dose for any of these drugs. I can go to the laboratory module and look up whether there has been any hepatotoxicity or nephrotoxicity because of the chronic use of these immunosuppressive medications, etc. Another thing is, these records are available 24/7, and there's no possibility of losing these records. With paper records, we are essentially putting all our eggs into one basket, meaning that if the file was lost or misplaced, years of valuable patient history is lost forever. In an electronic format with multiple backups, this risk is non-existent. Another important advantage, especially with the new generation EMRs, is that they are web-based and can be accessed from anywhere, unless a paper record or an old generation EMR where the doctor has to go to the hospital physically to access the file of the patient or order some drug for the patient. The next advantage is that records can be accessed at multiple sources. For example, a doctor can access a record to prepare a discharge summary, and at the same time, the admin could also be accessing the record to prepare his bills. And the nurse can also access the chart from another location to schedule his next appointment. Next is decreased medical errors and improved patient safety. For example, if I have a patient come to me with onychomycosis or interdigital tinea pedis, and I decide to give him an oral antifungal like itraconazole, I can see in his medication module that this patient is also currently on many other drugs for comorbidities that also includes atorvastatin. So considering that these drugs interact with each other and can result in skeletal muscle toxicity, I would then consider giving him another drug such as terbinafine, or might discuss with his physician regarding temporary reduction in the dose of atorvastatin. Another example, if a patient develops a fixed drug eruption to say a drug like cotrimoxazole, and this has been documented in the allergy module, next time if the drug is inadvertently prescribed by any other doctor, the system will alert the physician that the patient has had a reaction to this drug before. So these EMRs definitely help to reduce medical errors. Although we doctors like to think that we don't make mistakes, science proves us otherwise, and a high number of medical errors are due to because of human errors. The next feature is that most of these systems can provide reminders and alerts. For example, if I have a female patient of the childbearing age on a highly teratogenic drug such as isotretinoin, say for a grade 4 acne vulgaris, we know that this drug is very teratogenic, and all country guidelines mandate that pregnancy testing has to be done before the prescription can be filled every month. So I can then put in an alert that pregnancy testing has to be mandatory at every visit for this patient. The system will then alert the doctor, irrespective of whether Dr. A or B or C is there, and prevent any catastrophe for the patient due to teratogenicity, and also save the doctor from litigation and other complications in the future. Similarly, in our old hospital, we used to give a lot of biologics for psoriasis, and we know that tuberculin testing or IGRA is mandatory every year for these patients. So if an alert is put into the system will automatically alert the physician that this test is due every year in the month of August. And so irrespective of whether Dr. X or Y is there, there is a certain standardization of care, and the element of human error is somewhat reduced. The next thing is that computerized physician order entries are very, very useful, because when drugs are ordered by CPOE or labs, there is less chance of misinterpretation of orders due to bad handwriting. Also, prescriptions are sent to the pharmacy in real time, ahead of the patient, so when the patient arrives, the medication is already ready. There are so many other advantages. For example, most new generation EMR systems allow integration with insurance payment systems, allowing for more efficient and timely claims submission. Standardized ICD-10 diagnostic and procedure codes have paved the way for more accurate payment of new procedures, better administrative performance, and improved patient care. There are many other advantages of EMR systems that are beyond the scope of this discussion because of lack of time. So far, most of our discussion has focused on moving a medical practice from a paper to an electronic system. However, there are many practices that have already adopted some sort of electronic medical record keeping, and the number of such practices looking to change EMR systems is expected to increase substantially in the coming years for a variety of reasons. So there are a number of reasons why a practice might want to change or switch EMRs. Because maybe technology has become obsolete, maybe to gain added functionality, to achieve meaningful use, get better usability, find support and training, or whatever it may be. Switching between EHRs may be even more challenging a process than moving from paper to EHR. While all the challenges involved in switching from paper to EMR are also applicable while switching between EHRs, such as the time, cost, disruption to workflow, etc., the big issue here is with data migration. Migrating all of the data that is stored in your current EHR to your new EMR system is a huge undertaking and can result in considerable disruption and loss of data if not handled properly. However, the good news is that The ease of transferring medical records has been steadily improving over the last several years. Set standards have been developed, and the creation of these standards has made it easier to transfer patient care data from one provider to another. Now, nearly every industry has benefited from technology. For example, the aviation industry is nearly completely automated, and at every stage of the plane's operations, pilots have technology at their disposal to tell them if they are flying at the right altitude, to guide landing, to warn them if fuel is low, etc. I am sure none of us would want to fly in an aircraft that only depends on the manual skills of the pilot to get us safely to our destination. We have this opportunity to use technology today that is easily deployable to transform and improve the quality of care that we deliver to our patients. Utilizing technology in our practice shouldn't be something scary. It should be something that we embrace and encourage. The challenge is not technology because it is already available. The challenge is to make decision makers aware of this and wake up to the tremendous potential of these systems. Just to end on a lighter note, adopting to an electronic medical record system will obviate one of the major problems that has plagued the medical profession for centuries, that is bad doctors' handwriting. Thank you.
Thank you very much, Dr. Vijay. I shall now hand over to our acute care expert, Sudhakar, who will show us how an effective technology provider built such a system that enables hospitals to overcome the challenges Dr. Vijay cited earlier. Yes, Sudhakar, the stage is yours.
Yep. Thank you, Fangi and Dr. Vijay. Good afternoon to everyone. I'm Sudhakar Akala. I'm product manager for HS at Napier Healthcare Solutions. Dr. Vijay has very well presented the pain areas and challenges of doctors. I just quickly take few of the pointers and explain what we are doing at Napier to overcome these challenges. Workflow disruption and poor computer skills. These can be addressed by having a smooth transition plan, intuitive and easy to use screens. It is very important to understand existing workflow of the hospital and how it can be transformed to new generation systems, making sure that there is no loss of data and no or less downtime. This can be done by preparing solution mapping and have easy to use templates to migrate data into new system. When it comes to doctors, having intuitive screens, easy navigation, and hands-on on the system can help smooth transition. Another point from Dr. Vijay's presentation, where is my patient? Doctors feel that they need to spend more time on system and less time with patient. This can be addressed by showing the information and data capturing in a single view with simple clicks. The other point is a number of pages of manual records. Our data is fragmented into too many screens in legacy systems. This makes doctors to look for information flipping pages or navigating to a number of screens. But electronic systems can simplify this, providing right information at right time, where they should have option to choose what information they want to see. Well, knowing some of these challenges, let's see how Napier is trying to help with its solutions to their customers. First important aspect of the system is that doctors should know their tasks for the day. To-do list and notifications can help doctors know how their time can be managed better. As soon as doctors log into the system, they can see the current day tasks such as patient appointments, surgery schedules, referrals for second opinion or consultation, any abnormal results of the patients, on-call advice approvals, discharges planned for the day, or discharge summary approvals. This helps doctor optimal planning of their day and more time to spend with patients, which in turn helps better patient care. Coming to patient interactions, whenever patient comes to doctor can view longitudinal medical record of the patient that can highlight significant data in one view, which helps doctor to get right and appropriate data quickly. Each patient's problem is different and each doctor like to view information differently. Napier solution helps doctors have the view eyes they want. Napier solution also helps doctors to view data in graphical format. It's easy to see and understand quickly the trend of the patient condition specific to vitals and investigations. End of the day, when doctors move out of the hospital, we enable them to access application on their mobiles. At any point in time, doctors can have any immediate information to be known and also take appropriate action online. Now let's see how the system is designed to capture data easily. Data that is captured during a patient visit categorized into two types. One is through static screens and other is dynamic screens. Static screens are where data to be captured is defined and it does not change much from patient to patient or problem to problem. The examples are like capturing vitals, allergies, diagnosis. Dynamic screens are where data to be captured can vary depending on patient problem. Examples are chief complaints, review of systems, and physical examination. It can be doctor specific as each individual doctor like to capture, or it could be at the specialty or a department level. These screens can be easily defined as required with drag and drop options. Few doctors may like to capture descriptive data and few may like to capture by selecting predefined data elements. Dynamic screens can also include images where doctors can select problem areas on the image and annotate, making it easy to capture and also easy to refer back later. Having frequently used data helps doctors to capture from a limited data set, and also order sets can be for a specific problem or a treatment where with a single click complete or most of the prescription can be captured. With the technology improvements, it is possible to capture data with voice recognition. There are voice recognition systems where voice is converted to text, but now we are working on some of the advanced technologies where doctors can read out to create a prescription. System can understand and convert doctor voice into a transaction like a prescription or an order. Doctor can say, take paracetamol twice a day for 3 days. This can be converted into prescription automatically. While we are doing more and more automation to capture data, it is also important to have proper validations are also automated. Integrating clinical decision support systems such as drug knowledge base helps doctors finding out if there are any contraindications or patient is allergic can be known online immediately. The integration with other healthcare systems not only reduce repetitive data entry, it also make all the data available online. It could be packs where doctors can see DICOM images along with the radiology report without navigating to other systems. There are many more advanced enhancements in our product roadmap. We will discuss them in upcoming webinars. Now my colleague Dr. Bipasha will demonstrate you some of these functionalities. Thank you.
Thank you, Sudhakar. A very warm welcome to everyone for joining our webinar session. I am Dr. Vipasha, Solution Specialist at Napier Healthcare, and I will be giving you a walkthrough of Doctor Workbench module of Napier HIS. So let me start with a scenario where I am a cardio specialist, Dr. Preeti Rao, and I'm going to my hospital. On my way to my hospital, I log into the application through my mobile. This Doctor Workbench module is very easy for me to access on any device. The system also facilitates me to choose my home page when I log into the system. Since I had selected my work list as my home page, the system is displaying the same. The first thing that I want to look into is to check my appointments for the day and the week. Next thing I would do is to check my referrals. In the received referral list, I can see the details regarding the patients that are referred to me, such as patient name and patient ID, and referred by doctor, that is a friend and a colleague, Dr. Farooq. Since I have to start my day with my outpatients in the hospital, I'll quickly go through the list of patients I have. In a single click, I can look into the number of patients that I'm to deal with, number of outpatients, that these are 4, inpatients 8, and if there's any surgery scheduled for the day. Coming back to my work list, I can see Mr. Ahmed Mushtaq. Sorry, can I just, yeah. I can see Mr. Ahmed Mushtaq, an old patient of mine who has come for the regular consult. Before just starting the consultation, I'll quickly have a look at his records. So in a single view, single page, I can see the records of the patient. I can see the patient is hypertensive and currently dealing with unstable angina. He's having these medications. I can also view the vitals that are already captured by my nurse. To go further, see the trends of the patient, I'll see the vital graphical view of of the vitals of the patient. I can see the tabular view. I click on the graphical view and I can see the number of vitals that have been captured. The system also facilitates me to filter the specific vital that I want to see. I can see the blood pressure of my patient is gradually improving. I'll quickly prescribe him with the medications. So the system has facilitates me to search with generic name or brand name. It also facilitates me to record my frequently used drug medications, and I can see the active medication that patient is already taking. I will prescribe Emerald. I'll mark my duration for this prescription as 8 days. And you can see the system is on the basis of calculation, auto-populating the dates. It got saved. Going back to my work list, I'll see the number of inpatients that I have. Seeing this patient list, I remember that Mr. Andrew Lopez requires a surgery, and I click on the record. I quickly go through his record. I had given investigations for this patient, and I can view the details of the results which have come in a report format. Sorry. I will raise a surgery request for this patient. I'm referring this patient to a cardiothoracic surgeon. I can select the date and time for the surgery. And submit my request. It seems the surgery request has been already raised for this patient by my assistant. So quickly, with the interest of time, I'll show you the OT processes at the back end by logging in as Shruti, the OT admin. Over here, you can see the number of patients that were scheduled for the surgery are coming. I can schedule my OT for this particular patient. This is a comparative calendar for the number of OTs that are there in the hospital. Moving back to the doctor workbench module, I'll show you how the investigations are raised for a few patients. Let's say I select my inpatient Altab Hussain. I can see the records already there. He's having angina pectoris and he has allergic to food that is peanuts. And having these medications, I will give him an investigation. I can see already I had mentioned some investigations and reports are still pending. Giving the time, I will also select some more like fasting blood sugar. I can choose my priority. I can select the diagnosis against which I'm investigating the patient for and save the investigation. Coming back to the OT backend screens that go through for OT workflow. Over here, you can see surgery details can be captured. As you see, the patient was requested for this particular surgery. That name is coming. You can select the date and time as per your availability or the surgeon's availability. You can select the operation theater. And my thoracic surgeon was Vipasha. It is coming Vipasha like this. Coming to the OT nursing work list. Let me show you once the OT is booked. The record comes over here in OT nurse work list, which is nothing but operative work list. And you can select the type of activities that you want to do against a patient. Like I'll select my pre-op checklist. So these screens can be accessed by the doctor as well. Once it is done, he can review these screens and the checklist with the questions can be customized according to the requirements of the users. Concluding this session, I would like to give you the highlights of our application. The very first highlight is that it is accessible on any device, whether an iPad or mobile phone or my personal computer. I can access this system anywhere, anytime possible. And as Dr. Vijay had talked about the workflow disruption, so our system provides that feasibility to include the type of assessment forms that doctor needs. Only those set of assessments which he requires in his assessment screens, in that can be included. The visuals are very clean and simple. It also helped me to design my assessment forms. So it had the feasibility to include certain type of formats that I want in my forms, in my assessment forms, or in my reports. Thank you everyone for your time. Back to Fangi.
Thank you so much, Dr. Vipasha. Just to sum up what we talked about major challenges, particularly resistance by physicians. Dr. Vijay also talked to us about what exactly are our medical staff's concerns when it comes to moving on to an electronic system. And Sudhakar actually, gave us the rationale for designing and developing a solution such as ours for hospitals today. And Dr. Bipasha also took us through, basically she showed us the ropes of how a hospital information system would actually work, that it's effective to, that it's not just easy to use for physicians, but actually empowers them to become better at what they do, which is essentially care for people. So next up, basically, I'm here to take your questions. We have Dr. Vijay as well as Siddharka, who can take any of the questions from the audience. So if you look at the bottom, you can just type your questions in the chat box now. You see whether there's anything coming in. Okay, we have one right now. Just a second, it's already flashing in my box. So, okay, this one is for Dr. Vijay, and it talks about the transitional stage that medical staffers have to go through whenever, the hospital wants to move on and implement the EMR system. So the question is, how long did it take you, in your experience, to transition from your paper-based environment to an EMR environment? And what about the experiences of colleagues and your other counterparts out in the medical profession? Dr. Vijay?
Thank you for this question. When I moved from a paper-based to an EMR system, it took me like around 2 weeks to get used to the system. The system was good. It was user-friendly. It was very easy to learn. I just sat for about a week with one of my colleagues, and then sat for some time with the people from the computer department. And after that, I could manage on my own. Of course, there were some technical things that I did not understand. Like, for example, according to my specialty, if I did, say, a skin biopsy, I might not know where to enter this for histopathology assessments. I would not know. Then I would just pick up the phone and call one of my colleagues. And of course, our system was not customized for dermatology, so I would have to enter it in the normal surgical histopathology module. So these were some workarounds that we had to do because there was no specialized dermatology module. But apart from that, I found the transition very easy. And as I highlighted before, there are so many advantages that I think anyone who has worked in the electronic health record, with an electronic health record, would not ever think of going back to the paper-based system. As far as my colleagues were concerned, majority of them did not have any complaints about working with the electronic thing, except that if they were very slow at typing, then they found it quite tedious to enter the long patient note. And sometimes when the OP rush was too much, they would have to enter abbreviated notes and then go back and open a fresh encounter and type in the detailed notes later. But apart from that, everyone was quite happy using the system. And
Okay. Thank you very much, Dr. Vijay. I have another set of questions that's just come in. They're more for our acute care expert, Siddharka. Okay, it's very, very specific. So it's a series of questions. So I'll ask you the first one first. It's asking, can the OT module be used in capturing data in an OT in real time? Sorry, Siddharka, are you there? Okay, just a second. I think I have to unmute him. Sorry. Just a second, ladies and gentlemen. I have to unmute our host for today. Yes, Siddharka. Can you hang on to
Yes,
that?
fine.
Yes.
Yeah, yes. Yeah, the question is, can the OT model be used in capturing data in OT real time, right?
Yes.
Yes, the data can be captured in real time. There are a lot of things that are done during the a procedure or a surgery that which need to be captured in the system. So it has all the steps where when the insertion is done, that they can just tick, or they can have a touch screen and we just click on that and it can take the time which is online. And similarly that whatever the other medicines or any other things that whatever they are doing, plus each step what they want to capture can be defined and can be provided as a click, can be configured as a click, and online they can click and capture all the data. So while the surgery is going on, someone can even see what is exactly being done, the system outside of it.
Okay. Just another question that's a follow-up then, can the monitors and pumps in ICU and OT also be integrated with HIS?
Yes, absolutely. So Isoline that they have a interfacing option either with their proprietary protocols or any of the industry standard protocols. They can be integrated with the HIS and a data with a consolidated showed in HIS as an integrated manner. Okay.
I have one question from an audience member. What is the approach? It can be for both Dr. Vijay as well as Sudhakar. What is the approach Napier takes to actually convince a group of physicians to adopt EMR? Is there a step-by-step approach to it? I think it's Dr. Vijay and then Sudhakar with the 1-2 punch.
I think the answer lies in all that I spoke about before, all the advantages of EMR that I highlighted. Because I have worked basically in both the systems, paper-based as well as electronic. And so the advantages of electronic systems are so many that, as I outlined before, that I personally would never think of working in a paper-based system again. So there are immense advantages, as I highlighted, and I think this show was about that.
Okay.
Yeah.
Okay. Sudhakar, can you maybe elaborate on how, when you actually develop this solution for our customers, you actually make it easier? What are the things that you specifically target whenever it comes to a customer engagement to make it easier for the physicians to say, hey, I want this system. I'm willing to take this leap.
Yeah, sure. Yeah, basically it's like first show the advantage of using the system rather than asking them to capture the system. It should not be like a data entry system, but it is like a knowledge base that where they can actually get any information that they want it at any point in time. So it's like whatever that the EMR we are talking about, like a manual system, what Dr. Vijay was talking, that 10, 20, 30 pages and they are missing. So, but in a system that it is all structured and they can see a specific to a particular data. It could be the patient coming for a specific problem, and that doctor may be interested to see only related information for that particular problem. So he can just want to click, he can get all that information related to that particular problem and view in a different ways, and can also analyze to get understanding of it easily. Plus, while capturing the data, there are many other things that one is that define the templates that are very specific or relevant to the specialty or a problem, and also having voice recognition, what we discussed. So we actually working on some of the integrations with the IBM Bluemix, so that can actually help them to make it easy entry. So these are the things that it can help doctors to see the advantage of the system, and they'll definitely willing to move on to the systems.
Okay.
I would like to add one more example. We had a patient who had severe Stevens-Johnson's syndrome, like kind of allergy to a drug, cefalexin. And this patient, initially the findings were like SJS, but then he went on to develop complete toxic epidermal necrolysis. He was then referred to a secondary center. He was admitted in the burns ward, and by the grace of God, he recovered. After that, nearly 7 years later, the same patient presented to our hospital for a URI, for a urinary tract infection. And as luck would have it, his file was misplaced. Although they searched high and low, they couldn't trace his file. And as fate would have it, they opened a new file, and the doctor on duty prescribed the same drug for him again, and he developed the same reaction again. And after that, this patient was referred again back to the same center, which had electronic medical records in place, and they found that this was the same drug he was allergic to before, he reacted to before. So this example really explains or highlights how important it is to have electronic medical records. With paper records, we are just putting our put on the line. We are just putting all our, if we lose a record, then it's lost. Whereas with electronic medical records, it's there 24/7, it's there anytime you want it. And there's no chance that this data will ever get lost. So I think this is one big advantage of EMR over paper records.
Okay. We have, thank you, Dr. Vijay. Thank you, Sudhakar. I believe there is a new question for you. Do you prefer to, is there a preference out there for vendors like ours to deliver standard out-of-the-box products or perform detailed current future workflows? Between the two, which one is more effective, do you think?
Yeah, we prefer and recommend customers to use the standard workflows that are built in the system. And at the same time, that it is not that just one workflow what we have. The system can be configured in a multiple ways. So with our experience that we have in the industry over 20 years, me or Dr. Vijay, there are a few other colleagues. So we have built a system which is best in the industry. So we always recommend them to use the standard workflows.
Yes. Okay. Thank you, Sudhakar. Okay. We have one last question we can accommodate for today. It comes together actually. I think it talks about the same thing. First is, does your EMR or does EMR in general, does it have drawing tools? And is there technology for handwriting recognition for people to write by hand their notes? So it talks about doctor's notes. So it's essentially a question about whether you accept inputs from different kinds of sources other than just to go up to the computer and typing it in. So anybody, either Dr. Vijay or Sudhakar, who wants to go first? Okay, Sudhakar goes first.
Yeah, sure. Yes, it's just a integration with the OCR system, but since the system we built is based on simple templates where easily click and select the things rather than typing in. So we prefer to do that, but where it is required that in case of any challenges, it can be integrated with the system and can handwritten data can be captured as a document as well as can be converted with the software, which will become like a data. So the possibility is there, yes. Okay.
Thank you very much. I suppose that also extends to talking about mobility, because the most often, the most common instances in which you require inputs other than to, having to be at a computer with a keyboard is actually by the bedside of your patients. So can you tell us a little more about this whole mobility thing? I'm sure you guys already have something tool or a platform for ambulatory care or for doctors who are visiting bedsides.
Yes, Pange, we do have a mobile interface for our application. So it can be used at the bedside or wherever the patient is there. So rather than go and take information on a paper, come back to computer and enter, they can use tablets or mobiles and they can start capturing the data there itself. And apart from that, we also provide a barcode scanning, like when they go to a patient, they can just read the barcode of a wristband and patient will be selected automatically. Then when they do a medication administration, they can also scan the medication, so the system can automatically pick up what medication is being given. So there are a lot of things that we have done, and these user interfaces are available now.
Okay. I think that draws us out because we are running out of time now. So if there are any more other questions coming from the audience, rest assured we will answer them offline because we'll get in touch with you very, very quickly. Okay, I think we have one more we'd like to accommodate. Okay. There's talk about this EMR system that we have right now. Okay, the one last one for you, Sudhakar. Okay.
Yes.
Okay, is this EMR system integrated with RCM, coding, and billing? And how does it make that portion of our EMR system user-friendly?
Yes, it is seamlessly integrated with the RCM system. And the data, that is whatever is captured by doctor, whatever the information that needs to go to either to a billing or to insurance is automatically taken, and the workflows will start automatically. And then whatever the feedback coming from insurance in coverages or inclusions or exclusion is also possible to see by doctor online.
Okay. All right. Thank you very much, Sudhakar. Thank you very much, Dr. Vijay. Ladies and gentlemen, thank you so much for your time. We've come to the end of our program for today. Before we conclude, though, I'd like to remind you that we offer free consulting and an IT health check for your healthcare facility. You can write to us at this address and sign on today for your digital transformation, or you can wait for us to get in touch with you, because we will be in touch with you very soon to address some other questions you may have in mind offline. And we'll be in touch very much. Thank you so much for your time. With that, we conclude today's show. Thank you so much.